Today I'm going to tell you about 7 anxiety remedies that are non-selling and that you can buy without a prescription at the pharmacy. In fact, without a prescription, okay? So stay with me until the end of the video. This video is mainly for anxiety sufferers. You suffer from anxiety, generalized anxiety disorder, stress, tension. If you're impatient, have a short temper, if you have fibromyalgia, insomnia, this video is for you, okay? But first, don't forget to leave a comment, subscribe to our channel, and click on the little bell to activate notifications. It's very important that you click so that you know, for example, that there's a video like this one here, okay? There's a little bell here, click on it. Leave a like and send this video to all your groups, especially those anxious people, okay? I hope that with today's tips, you'll be able to alleviate, maybe even cure yourself of all the anxiety that's going around. Those of you who have been following me here for some time know that I'm all for treating illnesses and especially emotional disorders through food, natural herbs, and physical exercise. All this helps a lot to release endorphins, serotonin, dopamine, everything that's in it. I mean, not everything, right? Cocaine isn't going to help with that, to get rid of that anxiety, is it? However, there are times when things get so bad that we have to resort to conventional medication, right? But then you come up with that story and then, Dayan, these drugs are addictive, right? Yes, they are. And I've fallen victim to them myself. I need to tell you a little bit about myself in relation to my psychiatric desert. Those who haven't followed me here for long may not know, but 15 years ago, I was 35 and I was in the worst phase of my life, obese, with anxiety, high blood pressure, until I suffered a panic attack. After my panic attack, I went on a pilgrimage to the doctors, and of course, as you can imagine, I ended up with a full prescription of medication. During my recovery, which took years and years, I started taking L-theanine, which is the same drug as Alkadil. I took Rivotril. Rivotril I took until a while ago because I had to take it when I was going to fly, when I started to feel panic attacks. I took desvenlafaxine, carbamazepine, because in addition to my anxiety, I got angry easily and broke things. It's hard to say, isn't it? But I don't have a problem. I used to take antidepressants because I had a social phobia. I wanted to isolate myself. I didn't want to be around people. And then I weaned myself off them. I stopped. And after a certain period in my life, I started taking some again, but I never went back to the way I was before, right? Then I stopped. The fact is that at the moment, I don't take anything anymore. And that doesn't mean that I'm cured forever. It doesn't mean that I'll never use any medicine again. So I want you to first understand that many psychiatric illnesses, they can be there with you like a shadow. You may not even need to take medication, but sometimes it's there. Oh, why? Because we don't have the means to perform a lobotomy. In other words, to open up the brain, take out a piece of it and throw it away. Dayan explains further. Many of us, myself included, who had difficult childhoods, a childhood that wasn't so full of love, full of affection, many people who didn't have such a wonderful princess-like family environment, which is our most common environment in Brazil, aren't always going to be completely rid of these feelings. Completely what I'm talking about, right? So anxiety, emotional disturbances, they can accompany us there like a shadow, which you always have to try to keep at bay. I was brought up in a home where my father was a decent man, my mother too, but there was a lack of love. And when my siblings were born, the image of my home that I have in my head was a real, I'm sorry to say it, a real madhouse. There were fights, lack of love, disaffection, neediness everywhere. And it was in this environment that I was brought up, an environment of blackmail, an environment of emotional cruelty. In order for me to be who I am today, I had to reinvent myself, open my mind in the metaphorical sense, wash my brain, and take a lot of action. And it's these remedies, which I've already used a few times, that I'm going to share with you today, okay? So in today's live, I'm going to show you the ways I've used to avoid prescription drugs. And I'm going to show you 7 options for anxiety medication that aren't addictive and that you can even buy without a prescription, okay? So generalized anxiety disorder. It's a persistent condition that gets better and worse, right? It fluctuates. So sometimes the patient is more irritable, more impatient. Sometimes the anxiety subsides. And then drugs like Rivotril, Zolpidem, Alprazolam, and Diazepam, paroxetine, right? They're always touted as the solution. but they can be addictive, slow down your thinking, and make it difficult to remember things. In short, all this is a good reason to stay away from these drugs. Of course, that's not always possible, is it? However, there are pharmacy medicines whose active ingredients are old acquaintances of ours, and that if you consume them sometimes, and often you even consume them in the form of tea, but I'm going to talk about medicine here, okay? Medicines and even some supplements, which you already know and sometimes use for other things. Dayan, why are you talking about these medicines? I'm talking about them because they can sometimes help you to get out of a crisis, to face the public moment, okay? So the first one, Anxiodoron, do you know it? Anxiodoron. And I'd like to remind you that I'm not earning any money from any pharmaceutical industry to promote this, okay? My job here is to help those of you who often can't afford to see a psychiatrist or psychologist or even a doctor. This is something to help you, okay? This medicine acts on anxiety and insomnia. It contains two well-known herbs, passiflora and valerian. Anxiodoron works by increasing the action of the neurotransmitter GABA. GABA reduces the activity of the brain. In other words, you don't have a racing mind, and so you reduce anxiety. And for it to work, for you to lower that anxiety ball, you have to use this medicine for at least 30 days, okay? The second remedy is Calm Aid or Calm Aid, Calm Aid. This Calm Aid, it's made from lavender leaf, okay? Lavender leaf. And you need to use it for at least 2 months, right? People who know about aromatherapy, in the world of aromatherapy, which is therapy with smells, lavender has several scientific studies proving its effectiveness in treating anxiety. This Calm Aid is also known as Selexan and is produced in a German laboratory. You're more likely to buy it online, okay? This drug has been compared to paroxetine, which is one of the most commonly used antidepressants. In fact, it's an anxiolytic, most commonly used for anxiety, and also compared to lorazepam. This Calm Aid works by increasing serotonin concentrations, and it blocks the action of glutamate, which is responsible for producing a lot of excitement, right? So if it reduces excitement, it calms things down a bit. And this medicine has to be taken for at least 2 months before it starts to work, okay? The third medicine, which I've also used, is Propranolol. So Propranolol is a blood pressure medication. Yes, it's for blood pressure. It's an antihypertensive, it's a pressure medication. Some of you have used it or must have used it. It's often used to prevent the physical sensation of anxiety. So there are a lot of people, and I've been through a lot, who, when they have an anxiety crisis, have what? Tremors, dry mouth, cold sweat, dizziness, gastrointestinal discomfort, ringing in the ears, the urge to pee. People, I had too much. I had to pee all the time to get on a plane from here to Sao Paulo. I thought I had a prostate problem. It was anxiety. So people are afraid of having a heart attack. They're worried about getting sick. These people who have panic disorder, social phobia, fear of speaking in public, propranolol helps a lot. So why did you use propranolol? Believe me, I used it to help stop my tremors during surgery. I've already told you about this. Imagine, I was a vascular surgeon. I was operating on micro vessels and I had this little tremor. It's funny that it devastated me because sometimes I operated with a lot of people watching, then I would tremble, and a lot of people thought I was an alcoholic. I kept thinking, do people think I'm an alcoholic? And that's very bad for a surgeon. But thank God I got to know propranolol. Propranolol helped me a lot in those moments when I stopped shaking. Even without resolving my anxiety, I stopped shaking. And these were weaknesses that I hid even from myself. I used to take propranolol in hiding because I was ashamed to tell people that I was going through this. So do you still shake today? Zero. Why don't you shake? Because I treated my anxiety. I don't shake anymore. I can do whatever I want delicately. I don't shake anymore. So many people have a diagnosis of idiopathic tremor. Have you heard of this? That's the person who shakes, has all the tests, an MRI, and nothing comes back. Then the doctor says idiopathic tremor. In other words, there's no cause. But you'll see the tremor is anxiety. It's anxiety. So I use propranolol as well. The fourth drug is hydroxyzine. It's not a remedy for anxiety any more than propranolol is. Propranolol helps with anxiety, but it's a side effect. That's what we say, it's off-label use, outside the recommendation. Hydroxyzine isn't either. It's an antihistamine and anti-allergic, but it's also used for anxiety. So I'm giving you tips here so that you have options when you don't have your medication under control, you don't have a prescription. And this medicine improves symptoms of irritability, difficulty concentrating, apprehension, and social phobia. This medicine is generally used for allergies, itching, allergic symptoms in the body, right? So hydroxyzine also causes sleep as a side effect, so you sleep better. So if you think about it, it's better to use one of these than a Rivotril. On to the fifth. The fifth one is the one I'm currently using, which I bought in the United States. You can also buy it in supplement stores. I really want Vita Science to produce this supplement too, because I think it's wonderful for anxiety and insomnia. It's L-theanine. L-theanine is an amino acid. It's a natural remedy. It's even in the green tea leaf. That doesn't mean you have to drink green tea, does it? Not green tea at night to sleep, but people who drink green tea during the day sleep better at night, okay? I use L-theanine every day at night to sleep, so I bought it ready-made from a supplement store. The sixth natural remedy is lavender oil. I've already talked about Calm Ads, which is lavender in capsules. But you can also buy lavender oil in essential oil stores. You can drip it on your pillow. You can put it in a basin of warm water and make a scald and stay there smelling the lavender. You can also do as I do. Rosnevic gave me a present, which is a diffuser that you put in your room. And before you go to sleep, you leave it there, filling the room with essential oil. So you can do that. You can put 5 drops on the pillow, lavender essential oil. Okay? And the last one I've brought you is Vita Calm Night. This is from our company. Well, folks, that's it. Thank you very much for your affection. Thank you very much for coming. I hope you enjoyed the theme of this live. Sending you love and wishing you a wonderful week filled with immense tranquility and serenity. May you accomplish great things and experience an abundance of peacefulness throughout.